You know that sound, that sharp crack, followed by that sudden, intense pain? Breaking a bone is a pretty universal fear. It's this jarring interruption to our lives. But what's actually going on inside our bodies from that split second of injury all the way to the final stages of healing? Okay, let's dive into this and really demystify the entire journey of musculoskeletal trauma. And you'd be surprised just how common this journey is. Musculoskeletal trauma, which is, everything from fractures to severe tissue damage, it accounts for about 2/3 of all injuries. It's one of the main reasons for disability, and it really affects people of all ages. It's a great question, and it takes us deep into the body's absolutely incredible capacity for both injury and, well, repair. To really get a handle on the recovery, we first have to understand the break itself. All right, let's start right at the beginning, the moment of impact. What exactly is a fracture, and how do doctors and nurses even begin to classify the damage? So first things first, it's really important to know that a fracture isn't just some simple crack. It's a fundamental disruption in the bone structure. And that break is what triggers the immediate, intense pain and, as you can probably guess, has a huge impact on your ability to move. Now, not all breaks are created equal, right? One of the first ways they're classified is by how far the break actually goes across the bone. An incomplete fracture, for instance, only goes partway through. But a complete fracture, that snaps the bone into 2 or more separate pieces, which, can make for a much more complicated injury. And the next critical distinction is all about what's happening on the outside. A closed or simple fracture means your skin is still intact. But an open, or what we call a compound fracture, that's when a piece of bone actually pokes through the skin. And this, right away, creates a really serious risk of infection, because now the bone is exposed to the outside world. Okay, now this is where things get incredible. The body's response to a break is this remarkable cascade of events. It starts within hours, as a blood clot, called a hematoma, forms right at the site. Then, over the next few days and weeks, new tissue builds a sort of scaffold. After that, a soft callus forms around the break, which eventually hardens into brand new bone. The final stage, which can take up to a whole year, is remodeling, where the bone literally reshapes itself to become strong again. It's like this amazing multi-stage construction project happening inside your own body. So, the body's natural healing process is amazing, for sure, but it often needs a little help to make sure the bone sets just right. And this is where medical intervention becomes absolutely critical. The most straightforward approach is something called a closed reduction. The best way to think of it is a doctor manually guiding the broken bone ends back into alignment, but from outside the body. They'll do it with a careful pull or some traction, and once the bones are lined up, on goes a cast or a splint to hold them perfectly still while they heal. But for the more complex fractures, surgery is usually the way to go. The most common one is called ORAF. So the open reduction part means the surgeon actually makes an incision to see and realign the bone directly. And the internal fixation part, well, that's where they use hardware. Little metal pins, screws, or plates right on the bone to hold all the pieces together internally. This gives it super stable support. And then there's external fixation. In this case, pins are surgically placed through the skin and into the bone, but they connect to a rigid frame that stays outside the body. This method is often a total lifesaver for really severe open fractures, where there's a lot of damage to the skin and muscle around it, because it holds the bone stable while still letting doctors access the wound for care. The healing journey isn't always a straight line. And knowing about potential complications isn't about scaring you, it's about empowering you. It's about knowing what to watch for. Think of these as the serious plot twists we need to be aware of. Swelling, right? It's a totally normal part of healing. But there's a point where it can become a limb-threatening emergency. And that question brings us to a really dangerous condition called acute compartment syndrome. This is where it gets really dangerous because it becomes this vicious cycle. It starts when swelling inside a muscle compartment, which is a tight space, increases the pressure. That pressure then squeezes the blood vessels, which cuts down on circulation. That's called ischemia. Then, in response, the oxygen-starved tissues leak more fluid, causing even more swelling, which causes more pressure. It's this terrible feedback loop that can just rapidly destroy muscle and nerve tissue if it's not caught. So to catch this early, medical professionals look for what they call the 6 Ps. The very first one is pain that is way, way out of proportion to the injury. Then comes a feeling of intense pressure, followed by paralysis or weakness, paresthesia, that's the pins and needles feeling, pallor or paleness of the skin, and finally, and this is a very late and dangerous sign, pulselessness. Recognizing these early is everything. Another rare but super serious risk is an embolism, and there are two main types to look out for after a fracture. A blood clot embolism often starts somewhere else in the body, like a deep vein thrombosis in the leg. But a fat embolism is unique to fractures, especially of the big, long bones like your femur. That's where fat from inside the bone marrow can get into the bloodstream. The biggest clue to tell them apart clinically is that a fat embolism often shows up with confusion or altered mental status and this very specific little rash called petechia. Now, in the most severe cases of trauma, or when complications just can't be controlled, the journey can take its most difficult turn. We need to talk about amputation, but just as importantly, we need to talk about recovery and life after. While you might immediately think of traumatic accidents, most elective or planned amputations are actually the result of disease. Specifically, something called peripheral arterial disease, which is often linked to diabetes. It's where the circulation to a limb becomes so poor that the tissue just can't survive anymore. It's really a last resort when blood flow just can't be restored. One of the most common and honestly most misunderstood experiences after amputation is phantom limb pain. And this is so important to understand. This is a real sensation. The brain continues to send and receive signals from the nerves that used to go to the missing limb. It is not imaginary. It's a real physiological experience of pain that needs to be treated just like any other pain. And the way people describe this pain is just intense. They use words like burning, cramping, or crushing. This experience really captures the strange and surreal nature of feeling a part of your body that isn't physically there anymore. It just highlights the profound link between our brain's map of our body and our actual physical selves. So recovery, it's a huge, comprehensive process with a few key pillars. Physically, it starts with things like proper positioning to keep the joints from stiffening up, and muscle strengthening exercises to prepare the body for new ways of moving. There's also the very careful process of shaping the residual limb to get it ready for a prosthesis. But just as critical is the psychosocial support, helping someone navigate the grief, the changes in body image, and the whole emotional journey of adapting to a new life. When you really trace that entire arc, from the sudden violence of a fracture, through the intricate biological ballet of healing, all the way to the resilience it takes to overcome even the most profound physical changes, you're kind of left with one final thought. The human body's ability to break and our capacity to heal and adapt, it is nothing short of remarkable.